Early warning signs your health is declining. Have you ever felt exhausted even after a full night's sleep? Or noticed changes in your mood, weight, or skin that you can't explain? These could be subtle warning signs your health is quietly declining. We brush off persistent fatigue as stress. We explain away unexplained weight loss as a lucky break. We convince ourselves that lingering pain is just part of getting older, but here's the truth. Your body doesn't lie. And recognizing these early warning signs could literally save your life. Today, we are going to talk about the reliable, medically backed warning signs that your health may be declining, signs that doctors say you should never ignore. This isn't about creating fear. This is about empowering you with knowledge. Let's dive in. Let's start with one of the most commonly overlooked warning signs: unexplained weight changes. Now, I'm not talking about losing a few pounds after you started eating healthier or working out more. I'm talking about significant weight loss or gain that happens without any changes to your diet, exercise routine, or lifestyle. Medical experts define significant as losing more than 5% of your body weight over 6 to 12 months without trying. For someone who weighs 150 pounds, that's just 7.5 pounds. Why does this matter? Because unintentional weight loss can signal serious conditions like diabetes, where your body struggles to process sugar properly. It can indicate digestive disorders where nutrients aren't being absorbed. It can be an early sign of thyroid problems, chronic infections, or even cancer. Your body doesn't just randomly decide to shed weight when it's using up its energy reserves without explanation. It's often fighting something underneath the surface. On the flip side, sudden unexplained weight gain, especially when accompanied by fatigue or swelling, can point to thyroid dysfunction, heart problems, or kidney issues. If the number on your scale is changing dramatically and you haven't changed anything, consult your doctor. 2. Persistent fatigue. I don't mean the kind of tired you feel after a long day at work or a bad night's sleep. I'm talking about bone-deep exhaustion that doesn't improve even when you're getting enough rest. The kind of fatigue that feels different from normal tiredness, like something has fundamentally shifted in your energy levels. This type of persistent fatigue is one of the most common early warning signs of declining health. Yet it's also one of the most dismissed. People tell themselves, "I'm just busy," or "I'm getting older." But here's what medical professionals want you to know. Chronic fatigue that doesn't respond to rest can indicate anemia, where your body doesn't have enough healthy red blood cells to carry oxygen. It can signal diabetes, thyroid disorders, depression, sleep apnea, kidney disease, heart disease, or even cancer. Causes can include poor sleep quality, stress, nutritional deficiencies, or thyroid issues. Pay attention to when the fatigue started, how long it's lasted, and whether it's accompanied by other symptoms. Track your energy levels throughout the day. This information is incredibly valuable for your healthcare provider. Simple fixes: improve your sleep routine, manage stress, and ensure a balanced diet. If you've been exhausted for weeks or months despite adequate sleep, that's not normal aging. That's a signal worth investigating. 3. Changes in appetite and eating habits. Your relationship with food most determine your health. Significant changes in appetite, either eating much less than usual or experiencing sudden increases in hunger, can be early warning signs of serious conditions. Loss of appetite might seem harmless at first. You skip a meal here, don't finish your dinner there. But persistent disinterest in food, especially your favorite foods, can lead to nutritional deficiencies, weakness, and weight loss. It can indicate digestive problems, depression, or underlying medical conditions. Interestingly, a sudden spike in appetite can also be concerning, particularly if it's accompanied by weight loss. This combination might point to diabetes, where your body can't properly use the energy from food, or thyroid disorders that rev up your metabolism. Also pay attention to difficulty chewing or swallowing. These aren't just inconveniences, they can signal neurological issues, throat problems, or other serious conditions that need medical evaluation. If your eating patterns have changed significantly and you're not sure why, document what you're experiencing and bring it to your doctor's attention. 4. Frequent infections. Here's a warning sign many people don't connect to declining health. Getting sick more often than usual. If you're catching every cold that goes around your office. If infections seem to last longer than they used to. Or if you're taking antibiotics more frequently. Your immune system might be struggling. A healthy immune system is your body's defense force. When it's not keeping up, you become vulnerable to colds, flu, urinary tract infections, and other illnesses that your body would normally fight off more effectively. Frequent infections can indicate diabetes, which impairs immune function. They can signal HIV or other conditions that directly affect immunity. They can result from chronic stress, poor nutrition, or lack of sleep, all factors that suppress immune response. Keep track of how often you're getting sick, how long illnesses last, and how many courses of antibiotics you've needed. If you're visiting the doctor for infections more than a couple times a year, or if minor infections are taking weeks to resolve, that pattern deserves investigation. Your immune system is telling you something. Listen to it. And boost immunity by eating whole foods, staying active. 5. Persistent or unusual pain. Specifically, pain that doesn't go away or pain that seems unusual for your body. I'm talking about headaches that persist despite typical remedies. Back pain that lingers for weeks. Joint pain that's getting progressively worse. Abdominal discomfort that won't quit. Pain is your body's alarm system. Chronic, localized pain that sticks around isn't normal, and it shouldn't be ignored. Persistent headaches, for example, especially if they're sudden and severe or accompanied by vision changes, confusion, or neck stiffness, could indicate serious neurological issues. Chronic back pain might be muscular, or it could signal kidney problems, spine issues, or in rare cases, even cancer. Abdominal pain is particularly important to monitor. Sudden, severe abdominal pain requires immediate medical attention and could indicate appendicitis, gallbladder problems, pancreatitis, kidney stones, or other urgent conditions. Joint pain and muscle aches that are persistent or recurring frequently can point to inflammatory conditions, autoimmune disorders, or other systemic issues. Here's the key. If you're experiencing pain that lasts more than a few weeks, that's getting worse, or that's disrupting your daily life. Don't just tough it out. Track when it happens, how severe it is, what makes it better or worse, and share this information with your healthcare provider. Pain is information. Don't ignore what your body is trying to tell you. 6. Cognitive and mood changes. Your brain health is just as important as your physical health, and changes in cognition or mood can be early warning signs of decline. I'm talking about things like increased forgetfulness. That goes beyond normal. Where did I put my keys moments? Difficulty concentrating or thinking clearly. Confusion or disorientation, especially in familiar places. Mood swings, increased irritability, or persistent feelings of sadness or hopelessness. These changes might indicate early cognitive decline or conditions, like mild cognitive impairment, which doesn't always progress to dementia but requires monitoring. They can also signal depression, anxiety disorders, or other mental health conditions. Here's what's particularly important. Cognitive and mood changes can also result from physical health problems, thyroid disorders, vitamin deficiencies, medication side effects, infections, uncontrolled diabetes. All of these can affect how your brain functions. Warning signs to watch for include asking the same questions repeatedly, struggling with tasks that were once routine, getting lost in familiar locations, or experiencing significant personality changes. If you or someone close to you notices these changes, don't dismiss them as just aging. Many causes of cognitive and mood changes are treatable, especially when caught early. When we summarize, some of the most dangerous health problems don't cause pain or obvious symptoms. High blood pressure and high cholesterol develop silently, damaging your heart and blood vessels over time. Blood sugar changes can affect mood and focus. Anemia and thyroid problems often show up in blood tests before you feel anything is wrong. That's why regular checkups matter. Comparing current results with past labs can catch problems early, when treatment is easier and more effective. Watch for warning signs like sleep problems, skin or hair changes, bleeding gums, dehydration, or low energy after meals. Get emergency help for chest pain, trouble breathing, sudden confusion, weakness on one side, or loss of consciousness. For ongoing issues like fatigue, weight changes, or pain that won't go away, see your doctor. Early action saves lives. If you found this video helpful, like this video, subscribe, and turn on notifications for more evidence-based health content.